off of the iliac crest way up here by the anterior superior iliac spine, and then embeds itself into the iliotibial tract. This muscle functions like the name implies, to tense the iliotibial band, so the tensor fasciae, and its job is to stabilize the hip joint. And since this connective tissue extends all the way down to the lateral aspect of the tibia below the knee joint, it also functions to stabilize the knee. So that's the first muscle, is the tensor fasciae lata muscle, which we would locate right here. The next large muscle grouping is actually the quadricep group. This big group we can see here. I'm going to point out this is the knee. My finger's actually on the individual's patella, so that's the patella right there. And this really thick white connective tissue we see coming into the patella, that's the quadricep tendon that envelops the patella and then inserts down here on the tibial tuberosity. That's the patellar ligament. So if I move up, we can easily see that this is basically just having removed the skin and the superficial fascia over on the muscle compartment. I can actually see 3 of the 4 heads really easily. Running right up and down the midline of the thigh is the rectus femoris muscle. So I'm going to follow it from my patella all the way up. Rectus means parallel to the midline, and so I'm just following the belly of this muscle. It's going to go all the way up, and you'll notice it kind of dives under the tensor fasciae latae. I have to kind of go underneath it to follow it, and that's because the rectus femoris head is actually coming off of the anterior inferior iliac spine. So if I kind of go up in here, I'd be actually following the origin for the rectus femoris. So rectus femoris has an origin on the anterior inferior iliac spine. Its insertion is way down here on the tibial tuberosity, and its function is to extend the knee. Just on the lateral side and on the medial side are the 2 vastus muscles of the quadricep. So we have vastus medialis and vastus lateralis. So the vastus lateralis muscle, you can see the nice fascicles here, really nice big fascicles radiating out from the insertion. We can see that here. So this is the vastus lateralis, and this muscle is originating or coming off of the femur across the lateral aspect of the shaft. So it's not coming off the hip, but rather entirely the thigh. Vastus medialis, I'm going to just move a little bit over on this side, and you're going to see this nice fasciculation here going down, radiating around on the medial side of the thigh, and that's vastus medialis. And it will also have an origin on the shaft of the femur, but on the medial side. And of course, the insertion and action is the same. So tibial tuberosity and extension of the knee, right? And then the last one is the vastus intermedius. And if we were to lift rectus femoris up, kind of pull it across, you'll see that there's more muscle down there. In fact, what you're looking at is the shiny white connective tissue of the covering over that muscle. Okay, so that's like a really nice epimysium. So this right down there, underneath rectus femoris, right, on either side, and that's vastus intermedius, and that's covering the anterior aspect of the femoral shaft. Okay, so now we have our nice knee extender muscle. We have our tensor fasciae latae muscle. The next muscle we're going to look at is sartorius, which is a really great long strap-like muscle. That's this guy right here. Put my finger all the way around. You can see it's a strap. It's originating off of the anterior superior iliac spine. So if we go all the way up to where tensor fasciae latae is, this is also where sartorius is going to originate. So I kind of push the skin back there. You can see this muscle coming way up here off of the hip. And then it's going to come all the way down. It actually spirals around the thigh, and it goes all the way to this medial aspect. So I'm going to kind of follow it here and keep following it. And its job, oops, is to come on the medial aspect of the tibial condyle. So even though its origin is quite lateral, its insertion is going to be on the medial side, all the way down here on the tibial condyle. Okay, so the medial tibial condyle. The function of sartorius is going to be for a lateral rotation of the lower extremity. So it's going to take basically your knee and it's going to roll it out in this direction. Okay? So that's sartorius. What I really like about sartorius and the IT band is that it forms a really nice frame around the quadricep. So if you notice, here's the IT band, and here's sartorius, and sitting right between those two structures is our quadricep. Okay? So we have this nice V here that sort of surrounds and frames quadricep. Now I'm going to do is kind of shift over here to the medial aspect of the thigh, and I'm going to show you the medial adductor muscles. These are going to be a little bit harder to see just simply because the cadaver is intact here. The very first structure you're going to notice, though, is actually not a muscle but a vessel. This guy right here. This is a vessel that traverses all the way from the pelvis all the way down the medial aspect of the thigh, and then all the way down the medial aspect of the leg, and all the way down into the medial aspect of the foot. And then it goes over and creates this dorsal pedis arch. This muscle is called the great saphenous, which means the obvious. Saphenous means obvious. And it's one of the largest veins. In fact, it's the longest vein in the entire body. All right, so what we're going to look at are some of the adductors. We're not going to be able to see really clearly most of them, but we're going to look at gracilis, adductor magnus, and adductor longus for sure, and then see a little bit of brevis. So the first thing is to look at gracilis. So if we take kind of out of the way the great saphenous, I can see another triangle formed by my muscles. Tuck the saphenous in there. I can see my sartorius muscle here. And then on this side, really medial, is another strap-like muscle. This guy looks about the same size and shape. Pull it out. That's gracilis, which means delicate. It is the most medial muscle of the thigh, and it comes off the pubis, and it's going to insert, in fact, the same location as sartorius. So it goes all the way down this way, and it's going to insert right here on that medial tibio-condyle. Gracilis is one of the 5 adductors, and so it's easy to know what its job is. Its action is adduction. So that's to pull the thigh medially and to stabilize the limb during walking. The next muscle you'll see is actually this guy right here. That's adductor longus. It's the more superficial of the adductor muscles, and its job is to come off of pubis here, and then it goes to the middle of the shaft of the femur. And since the quadricep takes up most of the surface area for insertion, or sorry, for origin, we're going to find that the adductor longus doesn't have much to insert on, and so it's going to actually use the linea aspera for an insertion point. So it kind of takes up the middle part of the linea aspera. So this right here, this muscle, you can see right in the front, that is adductor longus. Deep to, or further down and behind, is this muscle. And so my finger's on longus, and behind that is magnus. This is magnus, adductor magnus, and then again I have gracilis. So again I have longus, magnus, and gracilis. Adductor magnus is, like the name implies, magnus means big. It originates from the pubis and all the way back to the ischial tuberosity, and it also inserts all along the entire linea aspera, all the way down to the distal aspect of the femur, and its job is to adduct. So that's adductor magnus. So again, we have longus in front, magnus behind, and then we have gracilis, which is this real strap-like muscle. If we want to see brevis and pectineus, we have to come way up here, and this is going to be a little bit hard to see because it's a very deep muscle, but if I kind of pull everything, I don't even know if I show you, but if I use my fingers and pull this down, you can see right here is more deep muscle. That's actually brevis. So it's really deep and it's pretty short. It's also going to be coming off of the ilium and then going all the way back down toward the femur. But those are, I think, from this perspective, going to be really hard to see. All right, so we're done with the thigh muscles. I'm going to stop the video and we'll do some leg muscles.